am Mrs. Arugomati Grace Omotayo from Nigeria in Africa. I was having this stomach pain. Then it was diagnosed that I had tumor in my stomach. Then they now drew biopsy and they said it was cancerous. That after that, that has started spreading. So they are the one that connected us to this place that I have to go to India for the treatment. I came down to Manipal Hospital for treatments. When I came, we were checked into a guest house. The arrangement had been made before we came. We arrived on a Sunday. Then on Monday we came to the hospital, to the information office, where they told us what to do. Then we started all the tests I have done in US all over again. And it was surprising that even within the 4 weeks interval, the thing has spread even more into the entire stomach, leaving just a little portion of the stomach for me. They now discovered I have some problem with my kidneys. Nobody had ever told me that before. So the doctor, I just did all the tests. See, I saw the neurologist. Almost, okay, Dr. Reddy, Vino Reddy is the doctor that treated me. He's my doctor. So he's the one that performed the operation. I learned it was a multiple, although he discussed it with me before the operation. So it was a multiple one. I didn't even know it until when I got to their operation room. So I take a deep breath. That was the last thing I remembered. The next thing, I just saw myself in the intensive care.
She is Arugomati Grace, 65-year-old lady who had a problem with eating and drinking and abdominal discomfort for almost 2 to 3 months with weight loss. On evaluating her, she was found to have a large stomach cancer with liver metastasis. Her preoperative workup showed she had T3N2M1 disease. Since she had total obstructing stomach cancer with bleeding, we planned to go ahead with surgery instead of neoadjuvant chemotherapy and planned for post-operative adjuvant chemotherapy. I did operate her about 7 days ago. I did a D2 resection with near total gastrectomy and lymph node clearance with metastatectomy in segment 3A of the liver. Her post-operative recovery has been very well. She has recovered from the surgery. She has been eating and drinking for the past 3 days, and I had put a feeding jejunostomy tube which has been fed on and off as the supplementary feeds. She is walking around, she is doing very well, and she will be discharged very soon.
Well, after the surgery, they did everything they could do, and I feel far better now, but I'm still recovering from the surgery. So, and I'm still praying to my Creator to make it 100% healing. But the doctor has assured me that, Madam, you have no problem, and I believe that God is at work, and God will do it and perfect His healing in my life. When I go back to Nigeria, let me be able to tell people about Manipal Hospital, that go there, that's the hospital you go. You go to India, don't just go to any hospital, go to Manipal Hospital.